The National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, the 26th of March. The next few days are crucial. Without decisive action, the number of people infected will rapidly increase from a few hundred to tens of thousands, and within a few weeks to hundreds of thousands. The nationwide lockdown is necessary to fundamentally disrupt the chain of transmission across society. I have accordingly directed the South African National Defence Force to be deployed to support the South African Police Service in ensuring that the measures we are announcing are implemented.
Yeah. Do you remember that all-important day? It's been 5 years since President Cyril Ramaphosa announced what would be a 21-day lockdown in an effort to stop the spread of COVID-19. Lives and jobs were lost, economies suffered, and businesses closed in the months that followed. So we're asking you, how do you think the COVID-19 pandemic impacted the country over the past 5 years, and certainly the lessons that our country has learned coming out of that very dark time? You'd remember that subsequent to that, South Africa saw 100,000 people losing their lives. A difficult time for South Africa on so many different facets. What do you remember about the beginning of lockdown? Send us a WhatsApp on 072-110-5584 or give us a call on 010-594-6010. We speak now to Section 27's budget policy analyst and researcher. Matshidiso Lengwasa joins us here in studio. And then virtually, of course, we will chat to the South African Medical Association's chairperson, Dr. Mvuyisi Mzukwa, Media Monitoring Africa's director, William Bird, who'll talk to us about what misinformation certainly looked like at this time 5 years ago. We'll also speak to Corruption Watch's senior researcher, Melusi Ngala. But let's start here in studio, Matshidiso. So perhaps you can take us back to what you remember about that day. You know, just before we went into the break, we were in that break, I was asking Dr. Mvuyisi, you know, do you still remember the day? And for so many of us, vivid, right? Because of just the fear being so palpable. You can talk to us about, you know, your memory of that day, what sticks out. But at that point, when we heard we were going into a 21-day lockdown, there were questions around, is it going to be just 21 days? Obviously, it was not. It ended up being a lot more than that. But then the education sector needed to figure out what now.
Yeah. Firstly, thank you for the opportunity to talk about this. And yes, you're right. It's so surprising that it's been 5 years, like time has flown, but we still remember the moment. I think everyone in the country remembers that moment when we realized that there would be a lockdown. And as you know, because there had been cases across the world, so it wasn't just happening in South Africa. I think there was a suspicion that this was probably going to last longer than 21 days, which inevitably happened. And yes, I think that, you know, every sector, you know, the economy was surprised. Everything was just, it was really that term of unprecedented times was really put to the test. And of course, it was such a pity for our education system, because already our education system in the country, especially our public education system, was so vulnerable, and so many of the learners are vulnerable and come from economically vulnerable families and households who maybe didn't have the same kind of resources and support to just, you know, just shut the economy down or shut everything down and everything would move forward. And so we did see that with, for example, when the school nutrition program was halted and Section 27 successfully sued to reinstate it, we realized that, you know, many learners rely on the school nutrition, like the meal as their only meal for the day. So it was just, you know, just a shocking time and just really sad in our history, but an important thing to talk about so that we can talk about pandemic preparedness in future and see how do we learn from the mistakes and learn from the lessons of a moment that was, you know, just so fear-inducing for the rest of the country.
Yeah, you know what I reflect on education, and I think about how at the beginning of this year we celebrated the class of 2024 matriculants, and they gave us our very best matric results since the dawn of our democracy. And yet this was the first group of matriculants that had actually been educated and had been much of it through that pandemic as well. So, yeah, a very difficult group and a resilient group of learners. Let's speak now to Dr. Mvuyisi Mzukwa, of course, with the South African Medical Association. My goodness, that the sector that is health, March 2020, on this day, the questions I can just imagine that the sector was asking itself about the wave that was going to hit our health facilities.
Good evening to you, Naledi, and your viewers and fellow panelists. I can still remember when we heard of this COVID-19 pandemic as announced by the World Health Organization. And what really happened is that immediately the Medical Association invited the then Minister, Zweli Mkhize, to come to our headquarters in Pretoria and really assure us as practitioners and as, the healthcare system in general, whether the country was prepared or not. And indeed, we get that reassurance from the minister that they were really prepared for the pandemic, but it proved the other way when the pandemic actually came to our shores. I think there are many views around the lockdown and the benefits of the lockdown. But what we noted was that, there was this so much uncertainty, even among healthcare professionals around the disease. It was really unsettling. And also, the virus was rapidly evolving, requiring healthcare professionals, to learn and adapt in real time. So there were so many issues. You find that at times, healthcare workers had to quickly implement, those personal protective measures, and with limited guidance at times and resources. Some doctors had to close their practices, like the dentists and stuff like that, because it was associated with the transmission of the virus. And many facilities actually had to construct those screening areas, you remember, at the entrances, to prevent the outbreak inside the hospitals. So there was so many moving parts, at the same time. And also this uncertainty, and at the same time, there was that loss of or lack of leadership, at times, to guide the forces, healthcare workers in that time. But we also noted, that the system, the pandemic itself, it really showed our response. It really showed, the need for a stronger infrastructure and protocols to handle any future pandemics, more effectively. And I thought we could have learned from, the H1N1 in 2009, but what also destroyed us was this information disorder, that came out in terms of, whether it's your social media and stuff like that. But there was lots of information that was really confusing communities and making it difficult to trust, science, to trust politicians, and even to trust, the response itself. So those are the challenges that really I could remember about the pandemic.
Yeah, and there were so many more, and we'll of course continue to unpack them. William, thank you so much for joining us as well. William Bird is, of course, Director of Media Monitoring Africa. Dr. Mzukwa there talks about the information disorder. Shoo, I mean, go back 5 years ago when people were afraid of 5G towers. I mean, do you remember that? You had communities that were wanting to burn down 5G towers. I mean, talk to us about, certainly what the past 5 years has taught us about the power of misinformation.
Yeah, it led to the UN Secretary General referring to it as an infodemic as well. And clearly it was a kind of a forerunner of where we are now, actually, on many levels, where we see levels of mis and disinformation at such heights. It seems at that time far less, but of course, it was the perfect environment for disinformation to spread, precisely because you had an unknown thing, something that researchers were still getting to grips with. You had governments responding in quite different ways, different departments. You had highly technical explanations, and you had people who were fearful for their lives. And in that environment, it's only too easy to see how people would be scared, and that means when you're fearful, you're very susceptible to mis and disinformation. So we saw, fortunately, not too much locally, but in the UK, we saw people actually attacking 5G towers, blaming them for the spread of this. We saw all sorts of other very dangerous ideas. That one of the kind of consequences, and profound ones, has been undermining the value of vaccines. So what was really interesting was it allowed us to see the kind of development of mis and disinformation, because as each piece of information arose, we suddenly saw how disinformation changed to meet that. So, for example, at the start, there was arguments of saying there's no such thing as COVID. It doesn't exist. It's all made up by government. It's an evil plot to try and control us. Then when the evidence was so overwhelmingly undeniable that it was clear and was real, then it became, well, the way that you stop COVID is you drink hot water upside down, you drink garlic. You had the former president of America, now the current president once again, Lord help us all, suggesting that maybe you could drink disinfectant, or that they could shine a light into you and that would somehow kill the virus. She had all this deeply damaging misinformation. And then as that evolved, you then had them spreading disinformation about the vaccine. And it really was a very fearful time. The thing that was really good about it, certainly from a South African perspective, was how communicators across the board came together. Governments, in terms of GCIS and Departments of Communications and the Department of Health, then working hand in hand with a range of civil society experts and groups, academics, came together to meet. We were meeting weekly, sometimes more regularly, to discuss, the trends that we were seeing and how we were going to try and combat those. So it was a really terrifying period, but also I think a really excellent one in terms of showing how in a time of crisis we really could come together as South Africans, across government, across private sector, to do all that we possibly could to mitigate the harm that was being caused by mis and disinformation. So I think there were some really positive lessons.
Yeah, some positive lessons, some tough lessons as well. Sure. You even forget about the stories around disinfectant and drinking water upside down, and there were so many of these myths. Perhaps you're more than welcome to send us a message as well, and some of those that really stand out for you. The most ridiculous things that people were saying to each other and how to, avoid getting COVID. But Melusi, you're with Corruption Watch. One of the things that a state of disaster being declared also meant was that it impacted how government then did its business, procurement processes, and then came about the PPE corruption scandal. I mean, let's talk about what COVID did for transparency and accountability where corruption is concerned.
Thank you, and good evening to the fellow panelists and to the viewers. Yeah, it was quite an interesting period, to put it very mildly. I mean, I remember at the time going through various corruption reports that the organization had received. And this was actually in preparation for a report on health that we were putting together at the time. And I was alarmed, to be honest. And by that time, you need to understand that I'm quite thick-skinned to issues of corruption and how corruption manifests and these various complaints. But there it was, several cases in which members of the public were ringing their alarm on how people associated with the then governing party were getting their friends and relatives involved in getting these huge tenders, PPE tenders at the time. And some of these companies were just established overnight, and this would prove to be true, of course, some of these allegations as seen in the SIU report, subsequent reports. And, it was that time when you are just trying to figure out how are we going to manage this whole situation. We know that already there's an issue of a trust deficit between the public and the government. We know as well that in terms of practices, we were struggling a lot as a country in terms of dealing with issues of corruption. But here we are finding ourselves in a situation where funds that are crucial in maintaining healthcare at a very serious moment in time were being reallocated, so to speak, or misappropriated and being stolen by people. People who did not have the prerequisite skills to be able to supply PPE or any of the machinery that was needed at the time by hospitals, for example, ventilators. And, it was that grand corruption happening, but also on a lesser scale, there were issues of food parcels. Councillors, for example, who would be stealing food that was meant for communities, because South Africans were quite giving at the time.
Yeah.
You had companies and so on who wanted to provide food. Government also wanted to provide food, but councillors at local government level would be stealing this food or selling it when they weren't supposed to do it. So these are the type of issues that we were dealing with.
I remember.
And more.
Yeah, I remember some of that. And we're going to unpack more of this, of course, as we look back on 5 years since lockdown of COVID-19. So on the 26th of March in 2020 at midnight, that lockdown kicked off. What have we learned from them? And certainly, what do you remember from that period? Where were you? And perhaps you'd like to reflect on how your family dealt with the time. Perhaps you've lost someone as well. 072-110-5584 to send us a WhatsApp. We continue after the break.
The National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, the 26th of March. The next few days are crucial. Without decisive action, the number of people infected will rapidly increase from a few hundred to tens of thousands, and within a few weeks to hundreds of thousands. The nationwide lockdown is necessary to fundamentally disrupt the chain of transmission across society. I have accordingly directed the South African National Defence Force to be deployed to support the South African Police Service in ensuring that the measures we are announcing are implemented.
And who can forget those all-important family meetings, as South Africans began to call them? Hashtag fellow South Africans became something that was readily on our lips as we waited for the president to tell us what next with the lockdown. But that they were a reminder of when the president announced that on the 26th of March 2020 at midnight, we would then enter 21 days of lockdown as we battled the COVID-19 pandemic. And we continue to talk about the lessons that we've learned in this 5 years from education, corruption, misinformation, and certainly the health sector, what it took out of that period. Taking your WhatsApps on 072-110-5584 or give us a call on 010-594-6010. Where were you? What do you remember? Matshidiso, one of the things, of course, that happened in the months that followed was many people lost their jobs. I mean, so many people lost their jobs. Industries that were completely shut down. Tourism, for instance, aviation. The most highly qualified people also joining the unemployment ranks. And so there was a call at that point for a grant system. Then began the SRD. I mean, talk to us about that journey to campaign for social security at such a desperate time?
Yeah, so I think this whole concept of universal basic income and social protection before 2020 was something more contentious. Like there was a lot more debate around it, even though there is still that sentiment today, but not to the same extent. However, when COVID hit and there was lockdown, it became more urgent and pressing, and we saw the impact of the economy just shutting down overnight and what that impact had on everyday people, and it just became more and more, just questioning the role of, the economy and how we can support each other. And so when the president did finally announce the 350 grants, yes, the amount is far below the poverty line, for example, but there was some welcomed it was welcomed in the sense that we're moving a step closer in terms of social protection, and social protection is constitutionally protected right. So it was something that was welcomed. However, since then there have been issues. Like, it was supposed to be a temporary measure, but then as a society we realized that our economy actually has not been creating jobs at the rate that it should be. And yes, there are people who lost their jobs during the pandemic, and during the lockdown. But actually, there are people who are permanently unemployed, for instance, who are job seekers. And so the grant has been extended year after year. And even to this day, it has been extended and it's now valued at 370 Rand, which still doesn't quite touch the poverty rates and the poverty line in our country. And so, just thinking about this, I think that we're moving into a context where we're now really rethinking social protection, because effectively, the COVID grant, to some extent, has become some form of universal basic income for many people in this country. But at the same time, people are calling for an economy that COVID has ended, and yet we still have that intervention that is like quite institutionalized. What do we need to do? Has our economy actually recovered? Have we been able to create enough jobs to lift people out of poverty, to be able to just allow people to secure their futures and households to secure their futures? And I think it is really just calling on, now talking about the budget that has been so topical, but to really call on industrialization in our country and building a country where there are enough jobs for people, so that, yes, our social protection can work in connection with existing opportunities for employment, because where we are right now, it doesn't seem so sustainable, especially with the finance minister pitting the SRD grants with the 0.5% VAT increase.
Yeah, very interesting. It is. I mean, here we are in 2025 and that grant still available. But the shortfall, what do we do with it, as the finance minister has continued to raise? William, I'll bring you back in here because, just as we played that clip of the president at the time announcing the beginning of this lockdown, we had hashtag family meetings all of a sudden, and South Africans waited for the president to speak. And there was almost, and there was already a silence, I suppose, in the country with the lockdown, but so much silence to listen to what the president had to say. I wonder what you take from government communications during COVID-19, particularly around transparency and information sharing, how well we did in that period.
So again, I think it's a bit of a mixed bag there, actually. You had our government, better than many other governments in developed nations, listening to the science. We had some of our best scientists speaking on television. The downside to that, of course, is that they tended to use very scientific language, very high levels of scientific knowledge and terms, and many of us didn't understand what on earth they were talking about. So to that extent, obviously, it then took a while for government to realize, okay, hang on a minute, we need to actually speak in a language that people understand. You had groups being set up that would help break that down, like COVID Comms, and then all of these other NGOs working to help take government messages, break them down. So you saw a whole network of entities spinning up to then go into communities, find out what were the issues they were not clear on, what were the key things, key concerns that they had, and then you could develop messaging in relationship to that. So I think what it did demonstrate was that there were certain people within government who were able and willing to, work well over their daily hours and well into the night just to make sure that we could address this crisis. And, as one of our other panelists has pointed out, there were equally some within the state machinery who saw this as an opportunity to loot. That was just an extraordinary thing to be doing. But I think in terms of communication, our government could have taken a number of very negative routes. They could, for example, have said, we're going to ban certain things, ban particular terms. What they did do was communicate often. There was regular briefings with the scientific community. And then, thankfully, we had our news media and news organizations, and their role cannot be underestimated. It's one of the things that we need to remember as we kind of move into this period now where we no longer know what's real and what isn't, is that in a time of crisis, we saw news organizations, audiences increasing dramatically because people in a time of crisis need to get information that they can rely on and understand. And to that extent, our news organizations helped people understand the core issues. So even though there were many, many mistakes made and many things that we did wrong over that deeply disturbing period, I think by and large, the kind of default assumptions around making sure people had access to information, listening to the science, going according to what we were think we should be doing and explaining that. I mean, there were some completely crazy and ridiculous things like banning hot food products and saying that you couldn't do certain things that were not explained, and there was no rationale behind them, and that was difficult for government. But I think that their willingness at the time to work hand in hand with civil society, with the private sector, with experts, academics, really was a really excellent model for how you can do communication in a way that really does reach from the lowest and most vulnerable groups and people with no access to those who have access to any kind of information.
Yeah, we're going to take a short break. When we come back, we're going to talk about whether or not the lessons were learned from the health sector as we contend with wanting to provide universal health care. And then, did we see accountability for the corruption as well on the other side of this? Stay with us. Welcome back. Well, we continue to reflect back on 5 years since the first COVID-19 lockdown. What have we learned, certainly where it comes to providing social security, education, how we deal with corruption, misinformation, and also lessons for the health sector? Taking your calls on 010-594-6010 and your WhatsApps on 072-110-5584. Munsami Naidu was calling in from Kempton Park. Munsami, good evening.
Hearing the comments on the radio, I just had the Crime Watch. That they found out that there was a lot of corruption cases taking place. And during the corruption cases, a lot of families have lost their husbands, sons, and wives and daughters, and lost even incomes in the household. Didn't the government consider any remuneration to these families?
Yeah, that is another big one, right? Remuneration, justice, and something that would have been asked for by so many people. Munsami, thank you so much for that. Let's take a look at some of the WhatsApps that have come in as well on this discussion as we reflect. Good enough says, evening, Naledi. 5 years after the pandemic impacted the country, left people jobless and vulnerable. Government needs to come up with some strategies to create employment for our youth and refrain from becoming a welfare state. Good enough in Dozuma there. Keyo says, evening, Naledi. COVID-19 has left us the legacy of the social relief of distress money that the country never budgeted for now. They're using it as an excuse to increase VAT with 0.5%. Apart from that, we also have had incompetent leaders who can't take decisions and always return treasury money every year. Keyo, we appreciate that message. Your friend Zedi Tseho says, hi, Naledi. COVID-19 impacted our country because many businesses suffered huge losses and many people were left jobless. When our president announced lockdown, most of us were shocked and didn't know what lockdown was, and not forgetting how many lives were lost during that time. Offensa, thank you. It certainly was a very dark period for our country. Matsidi, so this question of the SRD grant and the legacy of it, I think, is an important one. And perhaps in a moment we'll get into, what the sustainability of it. As we remember, we know that this was a response to the COVID-19 pandemic. Long term, can we sustain it? But let's talk medicine a little bit. Dr. Mzukwa, we come back to you as we talk about, at the moment, though, we're having this big discussion around providing universal health care and certainly what's going to be needed. What you did see, though, during the COVID-19 pandemic was public hospitals and private hospitals equally overwhelmed. What lessons do you think, as we wrap up, and these, of course, will be your final thoughts, should we be taking from the past 5 years and what came out of the pandemic on how we prepare for a wave of people needing medical assistance?
Well, the first thing that we need to acknowledge, Naledi, was the fact that the healthcare system was really exposed as under-resourced and also overwhelmed, like you said, both private and the public sector. But also there were delays in securing, vaccines and PPEs. There are many other issues that we could talk about around that. For example, the issue of wastages, where you find that there was mass fumigations of schools, police stations, clinics. It is as if we're chasing after cockroaches, yet we're dealing with a virus, that is airborne. So that was really disappointing from a clinical perspective. Now, what we've noted, Naledi, is that there's issues that have been neglected. For example, the issue of dealing with non-communicable diseases. During COVID-19, people that were at high risk are people who are with underlying medical conditions like diabetes and other lung diseases as well. So even today, we have not taken a preventive approach where we say, what do we do about diabetes? It is a pandemic on its own, but we have not, dealt with it in the country. And the other issue, as we talk about, the universal health coverage using NHI, we have not dealt with the issue of infrastructure. We have not dealt with the issue of ethical leadership and governance. We have not dealt with the issue of healthcare workers shortages. This is not coming from me, Naledi. It is a report by the health ombuds who has, cited some of these aspects in Gauteng, and also the then health ombuds, Professor William Makgoba, talking frankly about the challenges the healthcare system, pointing out the Gauteng, the Eastern Cape, KwaZulu-Natal. In fact, he said the picture could be painted across the country. So as we speak now, the challenges that we faced at that time, we have not really resolved.
Yeah.
So if we're coming up with another pandemic, I am sorry, we are still going to face difficulties. For example, healthcare workers have not recovered from COVID-19, even psychologically, from the burnout, from all these things. Instead, they were called heroes and heroines, a term that I don't agree with. Because when you say healthcare workers are heroes, it means they can't go and seek medical attention,
right,
when they have psychological problems.
Right.
How does a hero go to somebody look for help? So, those things, there was no time, for example, where healthcare workers were given an opportunity to deal with these, issues, the psychological issues. They lost their colleagues in the pandemic.
Yeah.
They lost their relatives. They were in the battle itself. So
Yeah.
there are many of these things that have not been corrected.
I specifically remember images of, healthcare practitioners standing in lines as they bid farewell in passages to their own colleagues in the country. I mean, just heartbreaking moments. Melissa, as we talk about the corruption, just two questions, and these, of course, will be your final thoughts around certainly what we've learned. And, did we take any sort of lessons on the importance of tightening the screws where corruption is concerned? But did we also ever see accountability sufficiently, that is? I mean, I'm looking at articles, for instance, that saw 50 million rand in assets, including vehicles that were seized by, the asset forfeiture unit after the COVID-19 pandemic. Was it sufficient? And what do we take from it moving forward?
Yes, Naledi, I just want to preface my remarks, though, by just stating that, look, when we talk about dealing with corruption, but also just the nature of corruption, it shouldn't be weaponized in a sense to kind of go against universal health care or any other provisions, even the SRD, for example, right, that are constitutional. We have a constitutional mandate. We have a human rights mandate to be able to do this. So when we talk about these issues, it's because we want these to be addressed, like the issue of corruption in South Africa. So the issue of the temporary employer relief scheme, for example, it has been raised in Parliament. I'm led to believe, which is 5 years later, but it's encouraging, and it was principally based on the work that my former colleagues did in that regard, in which we kind of put out a report highlighting how employers were stealing funds from the state because of this intersection between the state and the public when it comes to our understanding of corruption. But, there have been minimal accountability. And that accountability comes as a result of some foolish characters acting, out and being living a lavish lifestyle and bragging about it and so on and so forth. I can't remember the one guy's name. I think it was Hamilton or something. But yes, those were the instances where we saw accountability. It was encouraging to see, for example, the Special Investigative Unit looking into these issues for the purposes of bringing accountability. But subsequently to that, considering the amount of money that was stolen by companies, the amount of money stolen by politicians and high-level politicians, I should add, hundreds of millions of rands and billions in some instances, it's argued. We haven't seen that, and that's what matters to the public: seeing accountability and people being taken to court and going behind bars.
Yeah, we need to see the accountability. Matsidi, so we need to move towards wrapping it up. Lessons for the education sector and preparedness. I mean, at some point we need to talk. We were talking about virtual education, and so many schools simply weren't ready for it, right? So lessons that we take from the past 5 years, and also SRD, how sustainable?
Sure. So in terms of lessons, I think our panelists from the health sector, I think those insights also extend to education. So what happened there is that during COVID and the lockdown really exposed the inequalities in our education system, where learners who went to better resource schools were able to better pivot into online methods of learning, whereas learners who went to schools that are in more underserved communities struggled regarding that. Of course, then there was also the fight around the school nutrition program. And so I think it did just underscore that South Africa's education system, much like everything else in our country, is two-tiered, and there's so much inequality. And if we really want to move together and build an inclusive economy and a nation really that works for everyone, we really need to tackle this inequality issue that is plaguing our nation. And I think that also extends to the SRD grants, is that, there is a question about sustainability, but I know that a lot of our colleagues in the civil society space have been doing work to show that it is sustainable and there is a way to fund the SRD grants. However, when we go into communities and we do our outreach and engage with people, I think last week we were in Protea South and we spoke to the communities. I think the overwhelming insights, or what everyone was saying, is that really we really want opportunities for work. We really want to be able to contribute and build our economy. So yes, we can continue to extend the SRD grant, but ultimately all of the issues that we're facing, whether it's an under-resourced healthcare sector, education, and social protection, needs to be at the heart of building our economy so that we can, have job opportunities for everyone in this country.
And that support is necessary. All right, we'll take a look at just 3 WhatsApps as we close things off. Those that have come in from some of our viewers. Anonymous says, Naledi, hi, lockdown, very sad memories indeed. Some people found a way of making money out of the suffering of ordinary citizens. Don't wish it comes back again in any form. Anonymous, thank you so much for that. Driver Manaling in Mamelodi says, Tobela, the day reminds me of when we had to panic buy groceries in bulk as we were told that we were not going to be allowed to go out. Unfortunately, a lot of people lost their employment. Remember those queues, my goodness. Roy says, evening team, on the 26th of March 2020, I was placed on suspension by my employer. So it was lockdown for the country and lockout for me. I told my wife the whole country got suspended with me. Tough times. Roy, thank you so much for sending in that message. And thank you so much to our guests as well. Dr. Mvuyisi Mzugwa of the South African Medical Association. Matshidiso Lengwasa here in studio with us. Of course, budget analyst at Section 27. Melosi Ngala, senior researcher at Corruption Watch. And earlier we did chat to William Bird, director of Media Monitoring Africa. We take a short break. More news on the other side.